Good day. I'm Vanessa Pazernik, Senior Biostatistician in the Department of Research Support at A.T. Still University. Today's presentation will discuss research methods. This module is split into two parts. This is part 2. In part 1, we discuss the goal and learning objectives. To reiterate, the goal of this module is to understand how to transform your research question into valid research methods. Your research question was developed using that PICO framework. Specifically, you will be required to understand basics of study design, understand development of valid research methods, and understand good time management. In part 2, we'll be looking in depth at several example studies and their research methods. Our first example comes from a study published in the Journal of Dental Education. In Australia, no nationally standardized curriculum in pharmacotherapeutics exists, but dentists are expected to have this knowledge in order to prescribe medication effectively. So what the authors sought to study was first, just a descriptive, was what amount of medication knowledge do dental students in the final 2 years of their degrees have? And their PICO question was, is the amount of medication knowledge in dental students different between students in their final year and next to last year? So let's examine how they transformed their research question into valid research methods. The authors used a cross-sectional study design to measure medication knowledge during their current year in school. This is best for quantifying the prevalence of knowledge and examining the relationship between knowledge and student year. For the materials, the questionnaire was administered using Qualtrics software. The questions were formulated by an interdisciplinary team consisting of registered pharmacists, registered general dentists, and dental public health academics. The survey consisted of demographic details, one question about their confidence to prescribe after graduation, and 11 case items with only one of 4 clinically correct options. These were designed to represent content and skills expected to be taught in dental school. Information about the study and informed consent was created for all participants before completing the questionnaire. The interdisciplinary team supports validity by including a consensus of experts. The sample consisted of dental students in their final 2 years across 9 Australian dental schools. In the paper, they said 297 responses from both years were required to have a 5% margin of error, but didn't actually specify the estimate they were targeting with that level of precision. Based on the results, I think they were basing it on the estimate for proportion of those who answer more than half of those 11 case items correct. Providing this justification informs the expected precision level in numerical estimates. For the data collection, one person from each Australian dental school was contacted to distribute the study information, informed consent, and anonymous online link through Qualtrics. Additionally, student representatives were contacted to disseminate through social media. Reminder follow-up emails were sent monthly to encourage participation. It was at the student's discretion to consult any resources prior to answering the posed questions. The questionnaire was available over a 4-month period. By allowing the students to consult any resources prior to answering the posed questions, this supports validity by reflecting real-world practice. By allowing the link to be active for 4 months, this supports validity by allowing adequate time to complete the survey. For the statistical methods, frequency and proportion correct with 95% confidence intervals were calculated, as well as 2 sample proportion tests for proportion correct between year levels. The frequency and proportion answers the amount of medication knowledge, and this test in proportion answers the differences between years and amount of medication knowledge. Regarding the time management, we can only imagine how the study authors implemented their research methods. But here is an imagined example timeline where we list the date, associated action, and persons responsible for that action. We can be as detailed as we like, but in this example, I've kept the actions very broad. This may be explained more in our implementation module. Our second example is one from a past D3 research project. Type 2 diabetes mellitus is a metabolic disease that is one of the fastest growing diseases in the modern world. Dentists are interested in how it affects the oral cavity. So our PICO question is Do adult patients with type 2 diabetes obtaining dental care at the St. Louis Dental Center have a higher occurrence of dental caries than those without type 2 diabetes? So let's examine how they transform their research question into valid research methods. The study used a retrospective cohort design where the caries outcome had already been observed and looked back in time for the earlier evidence of exposure, the diagnosis of diabetes. This was useful to establish an association between diabetes and dental caries. Since the study used existing data, no materials were needed. The sample used adult patients at St. Louis Dental Center aged 21 to 99 years. For the data collection, the study members used the electronic dental records through Affinia to collect demographics, medication, DMFT indices, caries lesion sites, and number of root canal treated teeth. They could have also considered including known risk factors for caries to perhaps better estimate the effect of diabetes on caries. The severity of exposure was categorized into 3-level ordinal variable based on medication. This severity of exposure being categorized into a 3-level ordinal variable supports validity by replicating previous methods. The statistical methods included 2-sample t-tests in mean DMFT and mean number of missing teeth between type 2 diabetes mellitus and non-diabetic patients. This helps answer the amount of dental caries and differences between diabetes patients and non-diabetes patients, or controls. Here again is an imagined example timeline where we list the date, associated action, and persons responsible for that action. Our third and final example comes from a study published in the Journal of Public Health Dentistry. With the implementation of the Affordable Care Act in 2014, states, including Iowa, had the option to expand adult Medicaid programs. Iowa's Dental Wellness Plan was a tiered benefit structure where members earned additional covered benefits by maintaining routine dental appointments. Before the expansion, 82% of DWP members lacked dental coverage. So the PICO question is this: what is the difference in periodontal treatment need in adult patients between care financed by DWP and private pay? So let's examine how they transform their research question into valid research methods. The study authors used a cross-sectional design using retrospective data. It's cross-sectional because we don't know whether the insurance type, the exposure, preceded the treatment need. It's useful for establishing an association between treatment need and different insurance types. Since the study used existing data, no materials were needed. For the sample, all new patients at the University of Iowa College of Dentistry Oral Diagnosis Clinic who received a comprehensive oral evaluation from 2014 to 2016, aged 19 to 64, with at least 6 teeth were included. The final sample size was just over 1,200, which was all that were available, so no statistical justification was given. The University of Iowa College of Dentistry patient population was selected since a large proportion of DWP patients receive care at the dental school. To support validity, the study population was limited to just its oral diagnosis clinic, where examiner variability is expected to be low because all clinical findings are confirmed by supervising faculty members who are calibrated using standardized clinic protocols. This time period encompasses the first 2 years of DWP implementation, and this age range reflects DWP age limits. And this inclusion criteria is justified because it was used by another study. After removing duplicates and incompletes from the college's EHR system, comprehensive oral evaluations, including health history and clinical data, were collected. Treatment need was based on whole mouth CPITN score. CPITN scores of 3 or 4 indicate probing depths of at least 4 millimeters and a treatment recommendation for SRP. The CPITN index score was developed to identify treatment required to manage periodontal disease, so it supports validity seen in the dental community. For the statistical methods, multivariable logistic regression models tested for associations between insurance type and periodontal treatment need while adjusting for age and gender. These analyses answer the difference in treatment need between DWP and private pay. Here's the timeline that we can imagine the study authors use to implement their research methods. So in review, developing valid research methods that answer your research question takes thoughtful preparation. Most of all, seek advice when in doubt, and good luck. This concludes the Research Methods module, Part 2, developed by the Department of Research Support for A.T. Still University's Missouri School of Dentistry and Oral Health. Have a nice day.